Okay, so I am Pierre. For those who don't know me, I'm one of the fours. So when it came to senior lectures, picking a topic, I kind of went back and forth a lot. The good thing is that my classmates have been doing a good job at kind of providing very helpful educational lectures. So I decided to go a different route. Thanks, guys. I ultimately landed a topic that contributed to many of the reasons why I decided to go to med school in the first place and why I decided to become a doctor. And it ultimately boils down to the power of education, knowledge, and life experience. So what is not going forward? Come on. Carly, arrow, there. So for a little bit of a background, I am from Cameroon, for those who don't know. Although I mostly grew up in the West Coast, we have like a coast of the Atlantic Ocean. I was born in a small town in the Western province called Buda. And my parents had 7 kids. And of those 7 kids, there was a boy that was schizophrenic, and we had no idea. He was textbook classic perfect schizophrenic. Knowing what I know now, all the symptoms were there. When he had his first psychotic break, his first year of college, we of course had no idea what was going on. We took him to the hospital, or at least to Western Medicine Hospital, what version of that was available to us at the time. Still, he was not getting better. So the answer became this. If you wonder what that is a prayer camp. He was taken to a prayer camp where prayers, traditional rituals were the only form of medicine he was getting. The idea was that there were evil spirits in his body, and praying on him, those evil spirits will exit. He stayed there for many years, and it's not until a family friend, Western trained, flew in from Canada, diagnosed him formally with schizophrenia, put him on meds, that we started to see kind of the glimpse of the person that he was, although a little bit late because he ended up passing of a PE at the age of 26. I'm guessing many of you guys have questions at this point. Why is prayer a thing for mental illness, right? Is this even real life? I had the same questions when I was about 11 years old at this time, and still no answers. Around 2015, the New York Times actually released this article that kind of talks about the pretty much non-existent status of mental health in the Western coast of West Africa and some of the practices surrounding it. I remember at this time I was already here in the States, and I remember as a third-year medical student, I kind of brought up this article on my psych rotation, and people looked at me like I had 3 heads because they couldn't believe it. Fast forward some years later, by pretty much complete luck, I interviewed here last minute in January, and I ended up ranking Kings County first. And over the past 4 years, I've had several patients coming in accompanied by family for evaluation of bizarre behavior. And when you interview them, you talk to them, they exhibit at least one symptom of mental illness. Speaking to families, which are typically from the islands or the West Africa, there's at least one family member that either believes that mental illness is not a thing, or there is some sort of supernatural force at play. So the topic of my lecture today is pretty much mental illness and culture, right? And I want to talk specifically about the Western African perspective. This lecture is probably geared towards people more interested in global health and or social medicine, but I firmly believe that knowledge is important, education is important. You don't know what you don't know. And with the migrant surge happening now, and we're seeing a lot of patients coming in from Guinea and Western Africa, I think is a topic worth touching on to kind of understand what practices or what beliefs are out there so that you can best care for your patients. So as far as a roadmap, we are going to talk a little bit about mental illness in the Western world, right? Europe, United States, kind of for contrast and context. Then we are going to talk about the Western African perspective. I have West in parentheses because pretty much the belief encompasses the whole continent. Then we are going to talk about current practices, where the mental health has been in the past, where it is currently, and what is being done to kind of change things. So what exactly is mental illness? If you have access to Google and you Google it, there are many definitions that pop up. The overarching theme is that it's a group of diseases that affect a person's behavior, their mood, and ultimately their ability to function, whether it be acutely or in the long term. When we look at the DSM-5, we have a more nuanced definition, which it's a clinically significant behavioral or psychological syndrome or pattern that occurs in an individual and is associated with distress or disability, or with a significant increased risk of suffering. We have a classification. We have 21 groups of disorders that pretty much fall under 7 major disorders. Nevertheless, the overall idea is that there is more or less a clear grasp of what mental illness is. It is talked about, it is acknowledged. And because of that, we have a more or less understanding of how to best take care of people that are afflicted by mental illness, which ultimately, when it comes to treatment, it is ideally supposed to be like an interdisciplinary multi-angle approach that's taking care of the person that's afflicted by the disease, but also their close contacts like family and everybody else. When it comes to statistics, I'm not going to go in too deep into this, but the overall idea is that here, it is something again that is more or less understood, right? We have some knowledge about it. We know how to best care for it. And although there's much work to be done, something is being done about it. There's something is being done about it in the right way. Something worth mentioning, though, is that although we have more or less understanding and treatment, there is still a fraction of the population that do not receive the care they deserve, whether it be to lack of access, high cost, underdiagnosis or maldiagnosis, or other social factors. All right, so switching gears a little bit, I want to start us off with a quote. This quote was uttered by Ted Malanda. He's a prolific humorist and writer for a column in Kenya. And this was in 2014 when, what's his name? Robin Williams, this actor that suffered from severe depression, committed suicide. And the quote goes, "I can't wrap my mind around the fact that depression is an illness. In fact, it is such a non-issue that African languages never bothered to create a word for it." And sadly, he's right. In my own native tongue, Fefe, there's no word for depression. My grandmother had no idea what that was. And although kind of disturbing, this quote kind of encompasses the behavior and attitude toward mental illness on the whole continent. Non-existent, it's not an issue. So what are the beliefs on the continent, right? The overarching theme is that mental illness is something external to the person and it's caused by something that the person does. So if you fix that something else, the person is going to be just fine. The most common 3 ideas that are out there is, the first one is illicit drug use, which is not completely wrong. We have people, when they drink alcohol, they come in, they're acutely psychotic, they sleep it off, and then they're fine. The idea there is that people are doing too much drug, too much alcohol, hanging out with the wrong crowd. Take them to correctional facilities, help them unlearn the behavior, then they're going to be fine. The other belief is that it's caused by unemployment and vagrancy. It's kind of a backward thinking because a lot of these people on the continent end up being homeless because family either abandons them or they have no family. Vagrancy in most of the West African countries is illegal. Take them to prison or give them a place to stay or give them a job, then you fix the mental illness problem. The last one, which is the most common one, is the belief that it is the result of supernatural affliction. This comes from the fact that a lot of West Africans are very spiritual and very traditional people. Before the West came down, that's who they were at their core. With most of the population professing some sort of faith, they believe that if someone is exhibiting symptoms of mental illness, that is because they had a spell cast on them. And because of the spiritual problem, they need spiritual solutions. So enters prayer camps and traditional practices. But why is this the case, right? Why is it that this is the most prominent belief on the continent? Let's take a step back and look a little bit at data. Why is this not going forward? Carly? There. Sorry. This map is a little bit outdated. It's from 2017, but it kind of depicts the general idea. If you look at this map, it's telling us that the prevalence of mental illnesses in the West, when I say West, Americas, Europe, New Zealand, Australia, only about 10% of people on the Western coast, the West Africa has mental illness, which I find hard to believe. Like taking a little bit of a closer look, kind of breaking it down by countries, is telling us that only about 4% of people in Cameroon, where I'm from, suffer from mental illness, which I find it hard to believe. Just hypothetically speaking, if you don't believe that mental illness is a thing, there must be under-reporting, under-diagnosis, which then means that the overall burden of the disease is not really understood. We don't know how many people living on the continent actually suffer from mental illness. So because there's a flagrant lack of data, again, we don't understand the burden of the disease, right? You have people affected by mental illness and the people surrounding them that can't quite wrap their minds around what is happening to them. Most people on the continent, if you haven't been to school, you don't speak the Western language, either French or English. If there's no word in your own tongue to explain what's happening to you, how do you describe that to somebody else? Added to that, there's a lot of stigma. If the belief is that is the result of supernatural affliction, people generally don't want anything to do with you. So if you're believing that mental illness is a result of kind of supernatural affliction and you take it at face value, then in your mind, the treatment is, again, prayer and or traditional practices. Alternatively, for the small amount of people that actually do understand what mental illness is and kind of set out to seek Western medicine help, even them, they get very little help because that sector on the continent is very poorly developed or like the disease non-existent at all. Again, looking at some of the data, kind of the different countries on the Western coast, across the board in Africa in general, there's less than one psychiatrist per 10,000 people. In Cameroon, where I'm from, there are 3 psychiatrists, well, there were 3, 2 retired. The one that's working now just came back home from Senegal and still trying to understand the scope of the disease in the country. So why is this the case? Why is it that the mental health sector is so poorly developed? There's a low government investment in this sector because most countries spend less than 50 US cents per capita on mental health, which the recommended amount for developing countries is about $2. Why is the issue? Well, people cite that there are competing health and developmental priorities with allegedly insufficient funds. So they prioritize the development of the country versus development of the mental health sector because again, there is no data. People don't believe that it is a thing. So what then happens with this is that because there's the absence of personnel to study and diagnose mental illness, and also flagrantly poor access to mental health care, which all contributes to the fact that the actual scope of the disease is poorly understood. The people affected by the disease and their family are pretty much left to fend for themselves. The burden of care falls on family members. And when you have someone dealing with this overwhelming thing that they don't understand, it's costing them a lot of money. They are the talk of the town. They are shunned by everybody. They don't really know what to do. And then they hear from someone in the neighborhood that there is this person in the woods somewhere claiming to be the vessel of God and has the answer to your problem. Then in their mind, that's their best next option. So enter the prayer camps. I'm going to play you guys now a video that kind of depicts what these prayer camps are. If you actually please play. Oh no. Carly. How you play it? So this video was shot by New York Times in 2015 in their article, and actually went to one of these prayer camps to kind of depict what it looks like. Is it gonna play? Actually?
Is it on here?
Yeah, it's on here. Go down. No, click that down.
Keep talking.
The video kind of shows what these camps look like and what type of access to care they have, which is pretty much none. What these camps are is they are pretty much compounds in remote areas of countries, typically in the Western coast. Patients there are committed by family members after they have tried other things and it didn't work. They pretty much take their family members there in the hopes that they can get some help. There is no formal psychiatric or overall healthcare on those. There is no trained healthcare personnel.
Many of these people have mental illnesses. Their desperate families have left them here because they have nowhere else to turn. Daily prayers are their only treatment. This prayer center is one of the largest in Togo and one of many across West Africa. This evangelical pastor says he's doing God's work here.
Si quelqu'un est malade, comme un trouble mentaux, on n'a qu'à venir chez nous et on va prier pour eux. Par la grâce de Dieu, il va trouver la guérison.
Un homme ou une femme enchaîné, bloqué dans le bois. Je dis toujours, c'est pas leur faute, c'est pas la faute des familles, ils savent pas quoi faire. La grande.
Grégoire Aongbonon has spent his life trying to provide an alternative for people with mental illnesses.
Les malades mentaux sont les oubliés des oubliés. Ils sont considérés comme des gens qui sont possédés, frappés par la sorcellerie. Hein? Ils sont réduits comme des ordures, comme des déchets humains au milieu de la société.
Aongbonon is the founder of Saint Camille de Lely, a mental health organization that runs 8 centers in Ivory Coast, Benin, and Burkina Faso. We visited him in Benin, one of the poorest countries in the world. The government spends little on healthcare. Medical treatment for people with mental illness is almost non-existent.
Ce sont les derniers soucis de nos autorités. Au Bénin, d'où je suis originaire.
So that's pretty much a little bit of a glimpse of what those camps look like. So then again, they are pretty much places where patients are committed by their family in the hopes of getting some sort of help. The exact number of these facilities on the continent is unknown because there's nobody kind of regulating it, so we don't know exactly where they are. There's no formally trained healthcare personnel on those facilities. Patients that are there are taken care of by family, if they have family. These patients are typically chained and exposed to the elements or they're locked in dark rooms. The criteria for release from these camps is if the patient pretty much comes back to and asks to leave, which if someone is psychotic, what are the odds of that happening, right? Or if family decides that they're not pleased with the treatment there and they decide to leave. So obviously looking at it, the issue is assault of human dignity, right? You can have humans chained to trees and you can have psychotic people chained at all. It is a direct violation of the UN Disability Rights Convention, which most West African countries have indeed signed many years ago. So what is being done about this? Actually, I'm pretty glad to say that when I first encountered this some 20 years ago, when I was about 11, 12, although we still have a long way to go, a lot is being done or they're trying to do something about it. In 2015, there's been a UN Global Health Initiative where they pretty much allocated funds and launched programs to kind of help reduce a premature death from non-communicable diseases by about 1/3 to 1/4 by the year 2030. And this plan that they have has helped a lot with education and destigmatization of mental illness on the continent. A local initiative that are being done currently. Ghana is enacted a mental health act or policy called Act 846. This was put out in 2012. And it's one of the very few on the continent that urges officials and governments to actually instill a mental health budget and care for, to kind of develop the mental health sector and instill an infrastructure. And one of the important things that it does is that it requires every prayer camp in Ghana to be registered formally, so that at least we know where they are and we have a general understanding of what is happening there. They are requiring that there be a formally trained personnel, even if it's just for basic healthcare on those facilities. Those people can function as kind of frontline community workers and linked to care. They're also requiring a formal referral process to hospital for people that need it, which most of the patients there do need. And they require the humane treatment of patients, i.e. do not change them to trees. Other things that are being done is repurposing of old facilities. Is it popping up? Yes. So this picture here is the Kissy Mental Health Home, or known by most Sierra Leonean as the Lunatic Asylum. It was first built in 1800s by the British. And it initially served as a confinement for repatriated slaves that came from here back to Sierra Leone and that came home with PTSD. And for a long time, it served as the only sub-Saharan Western-style psych hospital. And when I say psych hospital, these patients were chained to beds. You can see the picture kind of up, and they received no formal healthcare or mental health care. So they would just lay in bed and scream. And the people, and the hospital is located on a mountain, so the screams would just reverberate down and everybody would hear it. In 2018, however, it is now change-free since 2018. So what they have done is that they repurposed the facility, and it is now one of the only West African psych facilities that offer mental health care to its population free of charge. They actually have psychiatry residents in training that are taking care of these people, and they are working under the guidance of the three only practicing psychiatrists in the whole country of Sierra Leone. Other things that are being done is the building of residency training programs. The government of Liberia kind of partnered with Boston Medical Center and their psych department to kind of instill a residency to have Liberians trained to become psychiatrists. This is a little bit more sustainable in the long run because they can take care of their own issues, they can take care of their own people, and it's something that can stay there long-term, long-standing. Other things that have been done locally is pretty much the use of advocacy, education, and awareness to tackle and dismantle the inherent belief system that surrounds mental illness on the continent. This has been done through campaigns and using pretty much faith and spirituality as kind of a vessel to engage populations, specifically elders, to kind of recognize that people with mental illness are still people and their humanity needs to be respected. And the way this has been done is through kind of radio spot ads, there are group therapies, there are talk shows. And the important part is that this is being done in languages that these people speak. So the most common languages in these different parts, in these different countries, that's in what the talk shows or whatever campaign they're having is being done so that they can actually understand what is happening. One organization, particularly in Togo, called the Blue Mind Foundation. It is a non-profit organization that's using kind of beauty supply and a hair salon as a way to have this conversation where hairstylists are formally trained to at least provide first aid mental health care. They function as a link to care between the hair salons and facilities and kind of provide follow-up and have these patients plugged into care when they need it. I don't know if this actually will play. Does it play? Yeah. So that's pretty much kind of what the setup it looks like. And it's proven to actually be efficient. Something else is the use of visual storytelling, writing, and photography. There have been a number of photographers on the continent that have taken on the job of really telling these people's stories in a way that is compelling, yet humane and respectful. And one of them was actually hired by New York Times to put out that article they put out in 2015, where I really believe that a picture is worth 1,000 words. So they kind of have pictures of these patients and what they've gone through, and kind of with a snippet of what the experience has been. And the important thing is that they're at least doing it in a way that is more or less respectful and bringing awareness to what they're going through. So some of these are the pictures that they have taken. Yeah. So that is the talk. No good senior lecture is done without thank yous and pictures. So thank you. And that at the bottom is thank you in my native tongue, Fefe, which says Ngopeno. Thank yous first to my two angels. That's my father, and that's my brother that passed at the age of 26. They've really taught me the art of taking care of people and complicated grief, which I think is something that I carry with me and kind of help me walk and take care of patients whenever I'm working clinically. To my families, those are my sisters and my nieces and my mom. At the bottom, they've really carried me through the whole pregnancy process and given me a good place. That's her dedication when I To my co-residents, we have the best class ever. I think that I've learned a lot from these guys, and we've had some really good times. And particularly to my little gangster, Sabi. She's been my little angel, and she's really taught me a lot through this process. And last but not least, to the whole program and leadership, New York was never an option for me. I didn't even know that Kings County, I didn't even know that Kings County existed to the last minute. I remember that I interviewed here and then I switched my whole plan around, and I'm really glad I did, because being here for the past 4 years is the first time since I moved in this country that I felt like I belonged, that I felt like I am home. And you guys are doing a really good job at creating an environment where residents can just be residents and not have to worry about much else. So for that, I'm forever grateful. And Kings County will always be home. All right, that's all I have.